Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. This is Pregnancy to Parenting. I'm Kawa Solomon, and once again we welcome Dr. Malika van der Skype, obstetrician and gynecologist practicing in the southern suburbs at Constantiaberg and Rondebosch Medical Center. Assalamu alaikum to you, Doctor.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you again for the invitation.
And your pleasure. Shukran for having us here in your Rondebosch rooms. Absolute pleasure being here once again. Now, looking at the second trimester, just kicking off a little bit where we end off as we started within the second trimester, yes. The scan just before your second trimester, yes. The blood test. Now we're looking at the next visit, inshallah.
Yes. And yes, we're now entering into the next phase of the pregnancy and heading towards mid-pregnancy. So this would be anywhere from 13 to 14 weeks onwards. And the second trimester actually ends at about 26 weeks, which is about 6 months. So it doesn't work if you divide by 4 when we try and calculate this. So remember, pregnancy goes to 40 weeks, which if you actually put on the calendar is 9 completed months. So at 26 weeks, you are just about 6 months by our calculation, 6 months gestation, and we're starting off at about 13 weeks, carrying on through that. And as you'd mentioned before previously, this is kind of the honeymoon phase. In that phase between, say, 14 to 22 or 24 weeks, it can be quite a nice phase, which we'll chat about as well in the pregnancy. And, you know, it's the stage in your pregnancy when hopefully you're starting to feel like yourself again. You know, you're beginning to feel like, oh, I'm back to being human again on various fronts. On the kind of mood swing front sometimes, on the appetite, the noxious fumes or smells or tastes in your mouth often settle. You find that you are actually able to eat better and maintain things better, and your energy levels, and sometimes just that fogginess and forgetfulness is much better. So it's often a very nice phase in pregnancy, and that's because at this stage, physiologically, what's happening in your body is that pregnancy is now a unit on its own. The placenta is formed, it's functioning, that baby is growing. We have that tiny little skeleton where everything is basically grown and formed. It's just increasing in size as we're heading through the pregnancies and through its different stages of development. So, for example, the heart is structurally formed. It is just now increasing in size as well. So that's what's happening within the body. And now your body, within the fetus that is, your body is starting to take over, to realize that it is pregnant. So what happens at that stage is that uterus is starting to increase a lot further. You're probably starting to show for a little while, and what happens is you can often end up having some ligament tendinitis or cramps as that uterus is growing and stretching. So it often ends up feeling like a weird kind of tearing, pulling feeling. That can be normal as we're heading to the second trimester, and as you're heading to the second trimester, with these physiological changes that's happening, your blood volume is busy increasing because your uterus is increasing in size. It's receiving a lot more blood flow. It ends up eventually becoming the second biggest organ after your heart getting its blood supply. So, you know, because it's going to be growing to a full-term pregnancy with its placenta and getting that vital blood supply. And your body acclimatizes to all of this by actually increasing your heart rate and decreasing your pulse rate. So it accommodates that kind of extra blood or extra weight blood and fluid by doing that. So increases your heart rate and drops your blood pressure. So why am I giving you like a science lesson now? It's because this is the stage where women need to be warned that, as I said, right at the beginning, like anywhere between 13 and 16 weeks of that second trimester, the cramps and pains in the side can be fine. Can feel like a tearing or pulling pain. The occasional feeling of palpitations, because your heart rate is increasing by 15 beats per minute, if not slightly more. So ever so often you might actually feel that. You might actually feel that kind of rise in heart rate. And sometimes patients are often worried about this, and it's one of those kind of frantic phone calls like, I'm having an anxiety attack, I think I'm having a heart attack, I'm not sure, my heart is beating out of my chest. So it's a nice thing for women to know that this is normal. If it becomes excessive, then it's a problem. Then we start checking, is your heart rate normal? Is your heart beating at its normal pace? Do you have some heart problem or abnormality? Or could it potentially be your thyroid if you continually complain about continuous palpitations? Or could it be stress and anxiety as well? And then what I was also mentioning was the fact that your blood pressure can actually drop. So your blood pressure can naturally drop a little bit. And for those patients who are used to functioning at a lower blood pressure, they may end up getting dizziness. So what can happen is we have what we call postural hypertension, that occasional moment of turning around quickly or getting up fast, and then just suddenly having that moment where you have that odd dizziness, or even actually, if it's bad summer months or things, actually being prone to actually fainting. And some of these can be perfectly acceptable and only the odd moment that you'll have. And if that dizziness continues and carries on, then we start saying, go look out for your abnormalities, or your problems. But this is often a good phase in pregnancy where your body can handle stress, or it's just as you've mentioned before, that honeymoon phase when you feel like you can at least center again.
So this is more the physiological changes that your body is going through, and you kind of feel a little bit, like you said, like yourself again, just with a little boop this time.
Absolutely.
And you're showing a little, so there's an excitement and also the feeling of how I actually feel. Before you didn't feel like you were pregnant. There's nothing to see. You just feel ill.
Yes, you didn't feel like it was this glow or this wonder.
Yes, say that pregnancy is meant to make you glow. It's not an illness, but you feel ill all the time within your first trimester, many of us. But then now we come to the second trimester, alhamdulillah. Does it mean now that the pregnancy is now more viable?
Absolutely. Of course, nobody can ever predict 100%, but once you're into that second trimester, and you've managed to actually truly get into that second trimester, chances of things going wrong there are few. And this is often why at this stage we say your body can handle that kind of stress, or that kind of any kind of stress or trauma. So for example, if your appendix were to rupture in the second trimester, heaven forbid, everything is, your body is strong enough to be able to deal with that without putting you at major risk. Obviously, you'd still, of miscarriage, you'd still be in a risky situation where that's concerned. But, this is why we often recommend in this phase that, get your traveling out of the way, or so I often, that's one of the big questions, when can I travel? Some of our pregnant moms are women who need to travel with their job and things like that, and so that's not a bad time in that second trimester to do that perhaps last honeymoon getaway that you might be able to do before you have to only start taking holidays during school holidays or things. And then, but I will talk about air travel, perhaps later in the show we can discuss air travel and that, but also, it's the time when we often say, go to the dentist as well, that they might be happier to work or get things checked. And, I must say, sometimes patients think that perhaps I'm colluding with some dentists, because I'm saying, go to the dentist from now until, perhaps 24 weeks and things, or if you want to do anything like getting teeth cleaning or that dental check or any pain, because, sometimes some of these old wives' tales really do come true. I don't know if you heard the one about for every pregnancy you sacrifice a tooth.
Yes. But why is that so? Why does your teeth take squeezing during pregnancy?
Physiologically, your calcium, and it's basically the lack of calcium, and not just that, the hormonal changes that happen, with the enamel, the fact that your gums can swell, the fact that you're prone to infection, that kind of thing. But it is physiological changes where teeth are concerned. It's actually been proven that can kind of sacrifice a tooth, so to speak. I mean, I'm not going to get into a whole lot of dentistry to say exactly what happens, but that is what can happen. And then also, it's also a time when you are too scared to act on things, and you're often thinking, "Oh, I've got a toothache. I'll leave it until afterwards." And
because I'm okay now.
I know I'm okay now, and you don't realize that it often gets worse in the third trimester. And I don't know if you've ever experienced toothache during pregnancy, but I've had patients who have said to me, those who've had pregnancies before, that said their toothache was worse than actually post-cesarean section pain or something, so that's often why I kind of hint and alert patients to say, please be, if you need to go to the dentist, please go. Yes, the dentists are great. They will make a plan for you either way if you do go outside of those times. And if it's in the first trimester or in the last trimester, I'm sure they will make a plan. If there's a, cavity or broken tooth or problem, or if you're needing to have a root canal or something, I'm sure they would make a plan. But ideally, those are the times that they would be happy enough to see you. And of course, just mentioning that they should check with your dentist when they are happy to see you.
Now, this whole dentist issue and the teeth hygiene thing, because it's not just about brushing your teeth and flossing and gargling and all of those wonderful things. Is there more? Because you mentioned the lack of calcium. So do you then take more calcium in, or is it in the multivitamin?
There are often calciums and magnesiums in the multivitamins, but often some of the physiological changes, and you've hinted to two things that physiologically can cause an issue. For example, one is that a lack of calcium or magnesium can sometimes cause cramps and pains, and that often sets in the later second trimester. Second trimester, in the beginning of the third, is that leg cramp and that leg spasm. So often, if diet-wise you're not increasing your calciums, you might artificially need to increase your calcium with a good supplement that has calcium, magnesium, and vitamin D, which often is a combination that would help with the absorption of that. And I mean, I think a healthy diet is vital and can be sufficient as well, calcium-wise, if you're taking them as well. But one of the other things that, as you were talking about flossing and things, is in the second trimester, because your blood flow is increasing. What I hadn't mentioned is physiologically, as I said, your blood volume increases, but you can sometimes be prone to the occasional nosebleed. You can even sometimes be prone to the occasional gum bleed, because those small blood vessels might not be able to deal with that. Or, heaven forbid, sometimes you can have the odd bleed because a blood vessel on the cervix has burst. So you'll have a vaginal bleed at say 14, 16 weeks, and it'll be complete panic stations. So even although I've said it might happen physiological, please don't hesitate to get that checked out. And what I do sometimes also say is, if you find very easy bruising or gum bleeds or nosebleed or something, just in and around that time, in that second trimester, maybe hold off on that omegas that you might be on, because that can sometimes just cause a little bit more easier bruising or the odd little ooziness. It's still a healthy product, don't get me wrong, but now and again, if you have gum disease or a problem or something, it might just make that flossing or cause that little bleed when you are busy with your oral hygiene.
Shukran so much, Dr. Monica. We end our first segment of this edition of Pregnancy to Parenting looking at the second trimester. Please stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. I'm Paula Solomon. Thank you so much for joining us. With me once again is Dr. Monica van der Skeep, obstetrician and gynecologist out in the southern suburbs here in Cape Town. Welcome back, Dr. Monica. looking at the second trimester, which we are in now, in the second trimester, we are about 13, 14 weeks now.
Yes.
Have we seen you already? We've seen you for our first visit. Is there another second visit?
Often, if there is going to be that fetal abnormality scan that we were talking about that happens in the first trimester, we will often tell you to see us after that. So you'll often see the patient for their second visit or potentially their third visit if you'd seen them twice in the first trimester already, at roughly about 16, 18 weeks, and that's a nice visit because that's the visit when you can start seeing if it's a boy or a girl. One of the things I didn't mention about one of the stresses of going for your first trimester, beginning second trimester fetal abnormality scan, which is mostly concentrating on Down syndrome, as we mentioned before. One of the pretty things about that is they can see that early if it's a boy or a girl, the gender, but often in and around kind of 16 weeks we can see, tell you. Of course,
that's the earliest?
Yes.
Because I know you do get the question in the first trimester.
Yes, absolutely. We can get that question when it's just a 2 millimeter little butterbean look child.
You saw something.
I know, I definitely saw something. And the dads are often confusing, thinking that, always thinking that it's boy, constantly. And then it's like, no, that's actually just the umbilical cord going to the placenta. It's not that yet. And kind of looking at that.
Are you sure?
That's that question we get a lot as well. And then often in that second trimester, if your child plays with and does not end up laying, all legs crossed or out of my vision or line of sight, often that would be the time when
I remember that, lying on the bed and just turn a little bit or go, move this way and then start hitting the tummy. The baby's sleeping.
That's why I sometimes recommend a slightly full bladder, not too full, and that's why I sometimes recommend having something sweet as well, so that child's at least moving around a little bit and awake and kind of wiggling, so you can actually see something, if there is something there or not.
That is the most fun part of it as well. And when you at the end of the consultation, it's like, are you happy or are you sad, or is this exciting news? Either way, alhamdulillah, it's a living being happening. Yeah. So that second visit can happen within the first trimester after the fetal assessment as well, and then in
and around that time, and by then ideally we should have established the blood test we'd spoken about. Kind of going to have those comprehensive blood tests. As I mentioned, your blood group, you should know by then. We check your, are you anemic or not, the full blood count. In private comprehensively, we check hepatitis, HIV, syphilis, and German measles. So you should have vital information by then about that. And that would be one. You should also by then, be given information about when to travel, and also by then we often will inform you or tell you that you should start looking out for subtle fetal movements that might be happening. Okay. And at about 16, 17 weeks is the earliest. Mm-hmm. And you often don't know.
That flutter.
Absolutely, and you need to inform us a little bit about that as well. That flutter that would happen, or you kind of think, I've got a lot of little gastric irritation or bubbles or things, and not realize until afterwards, this is movement, and when the child is moving. So I think your information around that, your blood tests as well, and just basically discussing what to expect, so it's not utterly foreign, to you as well.
So how big is the baby at this stage?
Well, at this stage, often it will be in and around the same kind of centimeters as weeks, so probably in around 16, 17 centimeters around them. They're kind of tiny by that stage, and only like 200 grams or less, at that stage. You can see that they're starting to look a little more human or less skeletal, and often, as I said, if you're really lucky, they're kind of moving around, and you can see gender as well, and start to feel the flutters and movements, and
so everything is there by then.
And then what I must just mention is, you're starting to feel fetal movements at 16, 17 weeks or beyond. Those who've had previous pregnancies will tell you they probably feel something earlier than 17 weeks. But your partner or husband or other people are not going to be able to to feel. Yeah. And often, they'd be talking about, can you feel that? Can you feel that?
Can I feel it? Yeah.
Exactly. And often they would only about a month later to about mid-pregnancy be able to feel things. And this is a stage when you also should be, starting to show your uterus is pretty much kind of between belly button and pubic bone area, midway through the pregnancy, you're kind of at the level of the umbilicus. That's how much your uterus has grown, in and around that time.
And here also you'll find that you can't go into your favorite pants anymore, your skirt is a little bit too tight, and you end up wearing thobes all the time.
And you start realizing sometimes that maternity fashion can be a little limiting.
Yes.
This is often when the fashions will pitch up with the elastic band or the big kind of nappy pillow and a nappy pin on the buttons and that as well. Yeah, that's quite normal.
Guide us through some of that. I mean, when you start showing you are expanding and you're growing a little bit. So, are there any no-nos when it comes to wearing too tight clothing or underwear that's also over the tummy or under the tummy? Guide us through that and what we shouldn't.
If I were to start kind of from the top down, just looking at fashion or bras or with regard to the breast. Breasts, for example, are increasing in size. Of course, in the first trimester, there was a lot of, there's often a lot of breast tenderness, irritation, sensitivity. Some of that sensitivity is going away, but sometimes, fashionably just underwire bras are not necessarily your friend, because sometimes those can be too constricting. And I can even have some patients who come and say that they have the occasional chest pain. And I've had 1 or 2 alerts thinking the patient has chest pain. And it was actually from bad, wearing a bra that's too tight or an incorrect size or things. And yes, we know that sometimes you don't want to kind of make the expense to go and get that expensive wardrobe that's not going to last, but make sure that especially where the chest is concerned, breast and bust where that's concerned, that, often in the first trimester, I'd recommend an inner support t-shirt, to sleep with one of those for support, or sports bras, or the maternity bras, which mimic your sports bras sometimes, providing some support as well for the back and providing support so it doesn't feel as though you're actually being suffocated or crushed.
It's something you can use again afterwards.
Yeah, absolutely. And I think, obviously, wearing constricting things, especially where the legs are concerned. So be cautious and aware that as your legs are starting to swell a little bit more or increase in size, your knee highs or your socks or your tight stockings and that, make sure that you don't end up leaving an imprint or something that could potentially cause clots in the legs because you haven't, you've worn something too tight, or circulation is a problem, where that's concerned. I think around the abdomen area that you were talking about, women are guided by comfort as well. And sometimes in the business and in the work setup, it doesn't always work out, that way. And I think as long as it's not something too constricting, and you will find that there are designer cycling shorts or pants or bands, which are your pregnancy bands, which try to prevent that really heavy feeling and allow you to kind of lift as well. And those are the ones that I would recommend, buy the ones that have been designed for that purpose, that have been kind of, you'll have support pants that actually crisscross, protect the abdomen, but still help to keep things well, in tow, so to speak. And actually just to make sure that, it isn't too tight or constricting, because as I've mentioned about your low blood pressure, it does make you prone to fainting. So the last thing you need to do is know that you've fainted because the pants were too tight.
So looking at the circulation issue and minor medical ailments within the second trimester or with pregnancies. Now, is this an issue when it comes to pregnant women? Are there some sort of little medical ailments?
Absolutely. One of the things, as I mentioned, when you have an element of low blood pressure, at this stage, I would say look out for anemia especially. Because that's one of the commonest ones that would happen as well in pregnancy.
Okay, I think we'll start there in the second. Thanks so much, Dr. Malika. Please stay with us. This is Pregnancy to Parenting. We are discussing the second trimester. Baby is growing a little bit and you're feeling that fluttering and you're also growing by size. So we'll hear more just after the break. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. This is Pregnancy to Parenting. I'm Koa Solomon. I'm in our third segment where we're looking at the second trimester. We are in our honeymoon phase, so there's lots of laughter and excitement things happening. We're down to our almost, I think, about third or fourth visit to the gynecologist. But to tell us more, we have obstetrician and gynecologist in studio with us, Dr. Malika van der Skeer. Malika, looking at, so now we're in the second trimester. There are little ailments, medical ailments that come up. We stop by anemia.
Yeah, I think I started with anemia because often if patients are known with anemia before, it can worsen in the pregnancy. And, also if they have low blood pressure, constantly feeling dizzy, they're used to having had heavy menstrual cycle, or if now it manifests itself because, as I mentioned, your blood pressure is busy dropping, but if you are anemic, you're already at a lower blood pressure, and you're functioning at that, and if it suddenly drops even lower, you feel dizzy, more palpitations, tiredness, exhaustion, that kind of thing. And even though that tiredness is a very common symptom, anemia can often get missed just because of that. And it's been shown statistically that sometimes obstetricians do miss anemia because you kind of think, you're tired, yeah, so what?
Yes.
It's part of pregnancy. And you also don't think, because you'll come and you'll say to me, it's the normal tiredness. So to bear in mind, and sometimes on that full blood count that I told you we end up taking sometimes, you can judge if the patient's anemic, and we need to be smart enough to know, okay, fine, it was maybe just at the borderline of anemia, but at the end of the pregnancy, a good 4 or 5 months later, if not more months later, you could potentially still be anemic. And it's a condition that just keeps worsening. So, for example, breastfeeding in itself can, you often can have a loss of iron there. The pregnancy and its birth in itself will cause a loss of blood. Sometimes your diet does not include iron-rich tablets, or sometimes iron-rich foods, or sometimes you just don't absorb the irons the way you usually would outside of pregnancy. So anemia is one of the things, and you'll find some of the clinics would just automatically add iron tablets, or doctors would just automatically add iron tablets. I tend to add it if the patient is symptomatic, and if the patient continues to stay symptomatic, because tiredness, I know I said one of the common ones was anemia, but tiredness truly is one of the commonest, symptoms. And we need to look out because, yes, it can be part of your body in pregnancy. Yes, it can be, if it's the second or the third pregnancy, you've got a child at home, you're just
stress.
Absolutely. And so that it can be anemia, it can be, a thyroid problem, it can be heart disease, it can be linked to diabetes, all of the kind of things we might touch on later, but just concentrating on anemia, one of the obvious treatments is just to supplement your iron.
Talking about iron, and I've often asked this, wasn't really sure whether there is a good iron, a really good iron, or just an iron. And I was told that you do actually get a tablet which is a really good iron and just a normal iron supplement. So talk to us about the difference.
There are lots and lots of supplements out there, and women will absorb their irons differently, and those who are prone to constipation, or some patients have ulcers or indigestion and things, and how they absorb them. So yes, each practitioner you'll know will have their favorites, they'll have their brands that they do. There are some which we believe are just supplementation, and then there are some that are actually registered as formal treatment, if that iron is really low. And you'll notice sometimes there'll be variations of dosages. So I might say to a patient, do twice a day for a week or two until you start feeling better. See that you find a relief from there. There are different formulations of iron. There's iron sulfate, iron gluconate. They can sometimes be in those little white or green kind of government issue pills that smell like iron and taste like iron and, turn the stools black and cause cramps and things. And then you can have gentler ones, your more natural ones that are available. You can have ones that are, we are so blessed with a wealth of medication. There are different formulations that are chelated irons, and my patients sometimes who don't like to have any, like popping pills or anything, you get a syrup these days. You get a chewy tablet in a chocolate flavor if you want to. There's even high density iron containing spa water or whatever. So spa water. So there are so many different tricks. Before we even say raisins, spinach, beetroot, nobody likes doing liver, broccoli, dates, molasses, things like that. And make sure that if you're doing your iron and you're actually consuming that iron, to be absolutely, to make sure that you're not having it with your tannins, which is teas, coffees, things like that, that they can interfere with the absorption. Some of the iron formulations come with the vitamin C because that helps to aid the absorption, but also to have your vitamin C boosted a little bit in the pregnancy. Other than the fact that, boosting your vitamin C in any case would be not a bad idea, assuming you can tolerate it. And that second biggest complaint, which is indigestion, doesn't eventually kind of settle in as well.
Okay, and the best vitamin C would be a separate vitamin C?
Honestly, yes, in the winter months you can, and there are vitamin C's very nicely either in there are vitamin C's in your supplement itself, yes, thanks, or sometimes some of the iron formulations have additional vitamin C in them as well. It's quite a lot of the newer combo ones will have that as well. But to be entirely honest, of orange juice, fruit, that can be just as easy as popping.
And when you're looking at your diet, is to include the greener type of veggies.
Absolutely.
And of course the livers that you don't necessarily like, but if you can tolerate it, that would be...
And not in excess, obviously.
Okay.
Yeah. So often when I say to a woman not in excess, sometimes because, I was mentioning about fish livers or the vitamin A content that might be in liver where that's concerned. So I often find, firstly I find a big population will just say, ew, and like, ew, don't talk to me about livers or anything like that. So that I know some patients will say to me, not interested.
But there's lots of things I know that old lifestyle will tell you to draw up the bloodiness of livers as well. But you can.
And then, so if there isn't that tablet, if you don't want to pop the pill, if you don't want to go through all of the various forms of iron supplementation, as we were saying, diet-wise, just to be absolutely sure that can help as well, to boost that. And it's generally, even if you're feeling slightly tired in that pregnancy, try and boost your iron naturally, first and see. And then know that if your doctor has said, the other thing that I must say, if we have said you're anemic and you are good with the tablets, because I do sometimes prescribe it to patients that I've forgotten, I can't, it gives me cramps, it causes constipation, things like that. There are different formulations to try and counter or treat where that's concerned or prevent that. So if that is not working and you are still feeling tired, dizzy, exhausted, palpitations, short of breath, out of breath, unable to perform your tasks, please let us know, because sometimes that iron doesn't get absorbed. Sometimes it isn't the iron. Sometimes it is that you have a heart murmur, a heart condition, a thyroid problem, something that's mimicking what you think is a simple complaint in pregnancy, but is actually underlying a much bigger problem. And sometimes it is that you cannot absorb the iron or you've been too anemic. Then sometimes you may need something like an iron infusion. It doesn't happen often in a pregnancy, but often those patients who are at huge risk, who've perhaps been consuming their irons for weeks at a time and it just hasn't worked.
What would this be? The infusion would be?
It would be often an intravenous infusion. At our unit, it happens with in conjunction consultation with the help of some of the hematologists in our unit as well at Constantiawood. So, it's not just, it's involving another practitioner as well to help and to do that. So it's not always that needs to happen, but know that if you are feeling excessively tired, there is help. Yeah, there is help, and it's not just sometimes anemia.
So anemia being one of the biggest minor or major
yes, one of the most major minor
in the second trimester. What else are we looking at? Because I'm thinking, there's the no, not the feet. The feet is not as much of an issue, but maybe the back, some headaches and stuff.
Sometimes, especially obviously now because of the weight of that uterus and as it's increasing and your posture changing and breast and busts are getting bigger and things, so backache can become a problem, in and around this time. And often those patients who are prone to backache can really be bothered badly with backache, and that can actually result in, needing to have some physio or, and sometimes also what we look at where backache is concerned is this is the stage when you come to visit the gynae or the doctor that we would check your urine as well. So it's looking out for infection. So infection can mimic backache as well, So we're looking at bladder infection, that is, yes, thanks. So we check your urine to check for bladder infection. We check for protein, because sometimes if protein is high in your urine, we worry about kidney problems, or we worry about high blood pressure. Blood pressure is a routine check of most pregnancies. We look at diabetes in pregnancy. Is there any glucose in your urine or any blood in your urine? Because I've recently had a spate of patients who had kidney stones that have been bothering them. So that is one of the other tests that we would do to kind of look at. And backache is also one of those which can be so common. It can be linked to work. One of the things I haven't said is probably the time when you need to adjust the chair, adjust the pillow, get the height or whatever of their chair or the car sorted to kind of see.
So that all helps.
Yeah.
The pain is Panado, your paracetamol rather the best bet.
Yeah, your paracetamol is about your only cure that you have at the moment. Yes, and to please mention not to use any of those lotions and potions that could potentially have any strong anti-inflammatories in them for muscle pain or for cramps or for backache or things like that. So mostly, get your friendly husband to massage your back or something, or using aquatherapy, pools, the bath, that kind of thing to help. And also bearing in mind that there are pregnancy classes that can, they're aquarobics, they're Pilates, there's pretty bellies, which is also involving kind of physio and Pilates. There's also the physiotherapist. Nobody really ends up wanting to jump, thinking, I'll probably just have backache. But sometimes that can help as well, especially with sciatica as well, which is, kind of an extension of backache.
More on the second trimester after the break, as we're looking at those little elements that does creep up surprisingly within this time. Back in a moment with Dr. Monica van der Scape on Pregnancy to Parenting. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. This is Pregnancy to Parenting. I'm Honeymoon. With me is Dr. Monica van der Scape, obstetrician and gynecologist practicing here in the southern suburbs in Cape Town. Welcome back, Dr. Monica. Just before the break, we mentioned the big backache.
Yes.
Happens somewhere in the late second trimester, right up until the end.
Yes.
And then you latched onto sciatica.
Yes.
Please take us through that.
Well, a lot of patients sometimes will contact us because there is this funny pain that happens in the back and often in the kind of gluteal or bum area, down the back of the leg and down the leg. often quite incapacitating. And, sometimes over the phone patients can't describe and we're not sure what's going on. Could it possibly be that? Could it possibly be a urinary tract infection or not? And sciatica is that sciatic nerve, as it comes out of the spine, it sometimes, and as it goes over the kind of sciatic notch in that, it can get swollen and compressed, and then that nerve ends up getting stretched or pushed or compressed, and you end up having that pain down the back of the leg. That can often be very irritating, and I sometimes find patients limping or just looking as though they're really in pain. And there are physio exercises and physiotherapy that can help where this is concerned as well, and there's certain exercises that you can do. So sometimes when patients call us about backache, one of the things, as I was saying, is to try and establish, is it due to constipation? Do you have usual backache? Could you be lifting up something heavy? Some of my patients who have toddlers or 2-year-olds or 4-year-olds or 3-year-olds are complaining about backache, but forgetting to mention that they're picking up their 12-kilogram child. And then, so don't forget about the heavy lifting or lifting up heavy things at work. As we said, your chair, constipation I've mentioned twice before, kidney stones and kidney infection or any kind of infection in the urinary tract, if it doesn't sound like the classic sciatic symptoms that we look out for.
So there are often women that suffers from the occasional UTI ever so often. What happens and what are the danger signs of UTI during pregnancy?
Yeah, I'm glad you asked, because sometimes the danger signs is just that there aren't any, that it can be silent, and sometimes it can be as dangerous as triggering preterm labor in that late second trimester or the early third trimester or throughout the pregnancy. That is, and it can sometimes be the cause of the occasional spotting or bleeding, so it can mimic a lot of things. It's difficult sometimes to highlight out just on the history, could there possibly be a urinary tract infection. Now, most women will know the symptoms: running to the toilet more often, burning when you urinate, perhaps concentrate a weird coloring of your urine, smelly urine, often just frequency and running to the toilet more often. Sometimes backache or upper backache or flank pain, where your kidneys are kind of situated that you can have that. Or if it's really bad, fevers. And, pregnancy puts you at risk of it for a couple of reasons. Partly because your bladder is being compressed by that child. Most patients will laugh and go, he or she is practically jumping on my bladder, using my bladder as a trampoline. Or towards the end, I once had a patient who said that he'd taken his wife to Century City, one of our big malls, and he said the only thing he remembered was his wife, stopped at every ladies' room from the one end to the other end of a large mall, and most patients can relate to that and understand that. But sometimes it can be a urinary tract infection, and this is often why we often with some of our multi-dipsticks will check whether or not there's any evidence of infection. And a lot of women are sometimes aghast that they've got this infection, thinking it's some commentary on your hygiene or your lack of hygiene, and it actually just is. Your bladder sometimes does not empty correctly because the head is pushing against it, the uterus is pushing against it. In between your bladder and your kidney is your ureter. That's being squished by the uterus coming down, growing, So sometimes you can have varying degrees of urinary tract infection or kidney infection. Urinary tract or bladder would just be, if you're complaining about lower abdominal pain, you're complaining of going to the bathroom more often with very small volumes. I think that would be one alerting sign I would say to women, associated with fever and cramps and pains. Often sometimes we're lucky enough to unearth that diagnosis of urinary tract infection and stop preterm labor, as well. And sometimes we have to look out that they can sometimes mimic kidney stones or, if you're often dehydrated or things, we need to look out and just see that you don't.
Is there any danger to the baby when you are suffering from UTI? And I know this could become in the late last trimester.
Mostly the preterm labor that would do that. The medications that we use to treat it, you know, most women don't want to go on lots of pills. So, you know, with the medication we use, obviously we choose one that are safe in pregnancy and yet would be susceptible to treating your urinary tract infection where that's concerned. But make no mistake, we really do not want to leave that untreated. You know, and I think one of the advice I can give to women is to say, you know, try and flush out kidneys. Nobody likes to hear me say, oh, drink lots of water. But, you know, I'm running to the bathroom more often. I'm not really keen on doing that. But, you know, use your soda waters, use your, the powders and that you can use to help flush out your kidneys and things, you know, like your granules and things that you mix up, and those often will have your sodium benzoate, your vitamin C where that's concerned. So even just cranberry juice, soda water with lemon, you know, flush out your kidneys, or just plain water, you know, to try and avoid that if you can.
I must say that is good advice also for ladies, just common general, to do that on a regular basis.
Absolutely.
But pregnant women to do it more because of the possibility of
being more susceptible. Absolutely.
Now, this is a big question for me, and I haven't often asked my gynae this, and maybe you've mentioned it in some way in your talks, but at every gynae visit, you have to give a urine sample. When you get there at the reception, you get the little tub.
Everybody knows down the corridor who's going to the gynae because they're walking back with that walk of shame.
Exactly, you know, do you wrap it in some toilet paper or what? Hide it in your bag?
I know, women are hiding it, but I often sometimes find the men walking with them, and you know, often a lot of my patients are very sweet and kind. They would dry it and wrap it in a bag, wrap it in with a kind of paper towel, and then carry it and things.
I did that.
Yeah, absolutely. We really appreciate when you do that. That's very thoughtful of you. Absolutely.
So, what do you need it for at every visit? Tell us.
And that was, as I was saying, checking for that urinary tract infection, checking for glucose, checking for protein in the urine, as I said, and checking for blood if there is any potential with that, because those will alert us to the different symptoms and ailments and potential problems that you could have. And I must say, please be aware, you can get the little sample pot from the doctor and do this in the comfort of your own home, or do your early morning sample, which is often the sample, the better one for analysis and for doing things, and bring that with you so you don't have to kind of do the walk of shame down the corridor kind of thing. But it does give us vital information, and that's why I said sometimes your urinary tract infections are so silent and the patients are almost disbelieving, and I kind of have to show them the little purple stripe that's now turned, which is supposed to be all nude color and has gone purple as signs of infection, because you can have a silent urinary tract infection, or it can go the other end of the spectrum and cause fevers and rigors and the shakes and cramps and pains around the abdomen if it's gone beyond just that little urinary tract and it's now affecting the rest of the renal system. And that sometimes women will tell you that would be the reason for an admission to hospital in the middle of the pregnancy.
Okay, because usually you hand off this little jar of urine and then it goes to the room and nothing is said after that.
Absolutely.
There's just this quietness about it.
I know. I think it's because sometimes we just dipstick it and we forget to kind of go, urine's fine, everything's okay. And sometimes the patient will turn around and go, was my urine fine? Was it okay? Yeah, it was fine. And then, kind of think, because it's such a knee-jerk reaction for us, I think that we, sometimes get used to forgetting.
Okay, so the visits now, we're probably on our fourth or fifth visit. Yes. What are the spaces?
We're often monthly now. It's often monthly in the first and second trimester, and as you're just heading out of that third trimester, it'll head into closer, like 3 weekly or 4 weekly. You'll find that sometimes the public sectors might stretch it to 6 weeks or longer. Yes, so as you know, the visits will get, your visits are going to start getting a lot closer as we head into the third trimester, and as we eventually head towards birth.
Inshallah. Shukran so much, Dr. Malika. Always a pleasure having you with us on Pregnancy to Parenting. Hope to see you next time, inshallah.
Inshallah. Wa alaikum salam wa rahmatullahi wa barakatuh.
That was Dr. Malika van der Schyff, and as we're closing off slowly but surely for the second trimester in your pregnancy, we will wrap that up in our next show and looking at the third trimester, the more exciting times. Yes, it's more ailments and ouches and anas, but more on the third trimester in our next show. Shukran so much for joining us today on Pregnancy to Parenting. I'm Hawa Solomon. Wassalamu alaikum wa rahmatullahi wa barakatuh.